Case study 13-1 total abdominal hysterectomy with bilateral spleniophorectomy. MT, a 60-year-old Garavita para 2, has spent 3 months under the care of her gynecologist for treatment of postmenopausal bleeding and cervical dysplasia. She has several vaginal examinations with pap smears, with urinary ultrasound, colposcopy, and intracervical biopsies, and a DC with cone biopsy. She wanted to take home hormone therapy, but her doctor thought she was too much at risk with abdominal cells in her cervix and the excess bleeding. She had TAH and BSO under general anesthesia with no complications and an uneventful recovery. Her uterus had been prolapsed with abdominal examination, but there was no signs of malignancy or PID. The pathology report revealed several lyomas with uterus and stenosis onto the right oviduct. She was discharged on the second postoperative day with few activity restrictions. CA had worked as a technologist in the IVF lab at University Medical Center for 4 years. Her department was Advanced Radioproductive Technology program. Although her work was primarily in the laboratory, she had followed up each patient through all 5 phases of the IVF and embryo transfer treatment cycle: follicular department, aspiration of the pre-ovulatory follicles, sperms preparation, IVF, and embryo transfer. Her department does both GIFT, gamete intrafallopian transfer, and VIFT, zygote intrafallopian transfer procedures. With the female patient is in surgery, having an ultrasound-guided transvacular oocyte retrieval. CA examines the recent donated sperm for mobility and quantity. She prepares an oocyte and a sample of the cytoplasm of the ova. As soon as she receives the cells from the OR after inoculation, she places the sterile petri dish of the fertilized oocytes in the incubator until they are ready to be introduced into the female patient. YA, a Garavita 2 para 1, at 39 weeks gestation, had been in active labor for several hours, fully effaced and dilated, yet unable to process. She had an uneventful pregnancy with good health, moderate weight gain, good fetal heart sounds, and no signs or symptoms of pregnancy-induced hypertension. X-ray preventory pelvimetry revealed CPD with the fetus in the right occiput posterior position. Changes in the fetal heart rate indicated fetal distress. YA was transported to the OR for emergency C-section under spinal anesthesia. After being placed in the supine position, YA had a urethral catheter inserted in her abdomen prepared with a antimicrobial solution. After draping, a transverse peripubic incision was made. A section was continued through the muscle layers of the uterus. with care not to nick the bladder. The uterus was incised through the lower segment 2 centimeters from the bladder. The fetal head was gently elevated through the incision, while the assistant put general pressure on the fundus. The baby's mouth and nose was suctioned with a bulb syringe, and the umbilical cord was clamped and cut. The baby was handed off to the attending pediatrician and OB nurse and placed in the radiant neonate warmer bed. The AP GARD score was 9 out of 9. The placenta was gently delivered from the uterus, and the scrub nurse checked the 3 vessels and filled the 2 sterile test tubes with cord blood for lab analysis. YA was given an injection of penicillin to stimulate urinary contraction. The uterus and abdomen was closed, and YA was transported to the PACU, post-anesthesia care unit. Question number 1. MTA Girvita 2 pair 2. This means she had 2 pregnancies and 2 births. An endoclavicle biopsy is a tissue sample from the lining of the cervix. A carotid is a scraping. A coloscopy is an examination of the vagina. Another name for lenoma is urine fibroid. Pregnancy-induced hypertension is also called preeclampsia. The occiput of the fetus is the back of the head. Pitocin is a trade for oxytocin. Displaced means removed. Cell produced by fertilization, zygote. Measurement of the pelvis is pelvimetry. Upper round position of the uterus, fundus. Method for rating a newborn's physical condition, EpiGARD, afterbirth, placenta. DC means dilation and carotid procedure. BOS means bilateral sympingo-orectomy. PID, pelvic inflammatory disease. HRT, hormone replacement therapy. IVF, the intravitreal fertilization. ICPD, pelvic distortion. OBs, obstetrician. GYN, gynecologist. GU, gynecology.